Health Care Services NCII, the donning and doping of our personal protective equipment or PPE. PPE refers to protective clothing, helmets, goggles, gloves, face masks, face shields, and other equipment designed to protect the wearer from any injury or spread of infection or diseases. It is commonly used in hospitals, doctors' offices, and laboratories. Wearing our PPE is very important because this will serve as the barrier between you as the healthcare provider and to your patient. The donning and doping of PPE proper procedure is a vital step in reducing contamination of the healthcare worker caring for patients with transmissible infectious diseases. This is critical to mitigating spread and maintaining the healthcare workforce. When wearing your PPE, there are some things that we need to remember. First, you have to check the perfect size for you. Second, you have to wear your PPE prior in meeting your patient. Third, when wearing your PPE, refrain from touching your face or other unnecessary surfaces or things.
These are the things that we need in donning. First, the gown, head cap, face mask, goggles or face shield, gloves, hand sanitizer or alcohol.
Now, I will demonstrate to you the proper donning of our PPE. First, you have to remove jewelry and accessories. But as for me, I don't usually wear jewelry or accessories. Then, wash your hands properly. Then, we're done with the hand washing. Then, wear the gown. It is worn first to protect the patient of microorganisms present on abdomen and arms of the healthcare staff. When wearing your gown, make sure you tie all the ties on the gown. You may be needing the assistance of other healthcare provider, but if you can do it alone, better. Then, put on the head cap. The head cap is used to cover the entirety of the wearer's hair or scalp to prevent contamination on the operating field. Then, put on your goggles or face shield. The goggles serve as the barrier of infection protecting the eyes, while the face shield is used to full face protection. But I'm using goggles. Then, put on the face mask. The face mask should tie on the crown of your head and the base neck. And if mask has loops, hook them appropriately around your ears. The face mask is used to prevent the bacteria from the wearer's mouth and nose, which is shed in liquid aerosols and droplets. Then, put on your gloves. The gloves is used to protect the hands from germs. Make sure you cover the cuff of your gown to prevent contamination of infection. Then repeat the process. Make sure it covers the wrist of the gown. And we're done with our donning of PPE. Then, considering that monitoring is done, let's do the doping of our PPE. In doping our PPE, the outer part is considered contaminated, so do not touch any of the outer part. Remove the gloves. In removing the gloves, insert your finger inside the gloves or pinch it when you are still using the. Make sure you do not touch the outer part. Then discard properly. Then, in removing on the other hand, insert your finger. Slowly. Make sure you do not touch the outer part. Then, discard properly. Then, remove the goggles. Make sure you do not touch the outer part. for your face. Then, disinfect. Then, remove your head cap. Insert your finger. Then, discard properly. Then, remove the tie of your gown to remove the gown. Make sure it cannot cause any additional contamination. Then, insert your hands inside the gown. Then, crumple. Discard properly. Then, remove your mask and discard. Then, we're done with the doffing of our PPE. After doffing our PPE, we need to wash our hands properly, then disinfect. Then, we're done with the hand washing. After washing your hands, disinfect with alcohol or sanitizer. Wearing our PPE is mandatory nowadays, especially our face masks and face shields, not only to protect ourselves, but also the people around us. So it is very important to know the proper donning and doping of our personal protective equipment. Stay safe and God bless!